My name is Danny Sands. I'm an assistant professor of medicine at Harvard Medical School. I'm a primary care physician at Beth Israel Deaconess Medical Center in Boston, and I'm a co-founder and co-chair of the Society for Participatory Medicine. I think that we need to make healthcare more participatory if we really want to personalize it and make it something that that people want to be a part of. We want healthcare to be something that is engaging to all stakeholders, particularly the patient, the individual, the citizen. That's the ultimate stakeholder in healthcare. So involving them in a participatory way, getting them involved in their own health and their own healthcare becomes very, very important. Well, in the participatory medicine sense, I think the biggest challenge that we have is attitude. It's cultural. So as I define participatory medicine as a collaboration in healthcare between the patient and the doctor. So in that sense, that requires open communication, sharing of information, and shared decision making and so on. And many of these things are antithetical to the traditional role of the physician as the person who knows it all, does not necessarily share information, certainly doesn't want you to have access to information about your disease or even about yourself. So this is a cultural shift, because the doctor can't really be the god, the dictatorial one. The doctor is more like a partner. So I think the biggest challenge on that front is really that cultural issue. And I would say that patients have another piece of this too, because many patients aren't comfortable being in an active role in their health care. They view health care as like a car wash. I don't know if you have car washes here, but you drive through the car wash. So the patient is like the car going through the car wash, and they get health sprinkled on them. And that model doesn't work. Healthcare doesn't work well that way. Patients really need to be actively engaged, so that's something that we need to teach patients, is we need to teach them how to be engaged in their health. Now, on the larger issue of P for medicine, I think we have additional challenges, because working some of the interesting things that we've talked about at this conference into real healthcare, into general practice, is still a long way away. And I think there's a lot of hype and excitement about all of this, but it's not really penetrating down or diffusing down to the area where I work, which is at the front line, taking care of patients. The highest priority in participatory medicine is really education of all the stakeholders, of patients, of citizens, of caregivers who are non-healthcare professionals, as well as healthcare providers, doctors, nurses, and so on. I think it's really education about what is the value of this, how do you get started. I think that's really the most important and highest priority. Well, clearly the founders of the Society for Participatory Medicine should receive a Nobel Prize for the wonderful work that we've done.